This is Edward Guerin, MFT, Marriage Family Therapist, license number MFC 27181, State of California. And I want to have a little conversation about medication, psychotropic medication. Because a lot of people in the United States now take antidepressants. We give our children drugs for attention deficit disorder and attention hyperactivity disorder, ADHD, attention deficit hyperactivity disorder. We give people medication for depression, we give people medication for anxiety, and we give people medication for bipolar disorder, we give people medication for psychosis, schizophrenia, it goes on and on. So the first thing I want to say about medication is, because I'm a master's level practitioner, I cannot prescribe medication. I'm not a psychiatrist, and I would suggest that if you're going to take any kind of psychotropic medication, any kind of antidepressants, that you really need to consult with a psychiatrist for a prescription for that medication. And it's very important, if you take medication, that you also receive weekly psychotherapy from someone like me. Going in once a month, having a 15-minute meeting, and getting a prescription is not therapy. It's not therapy. It's medication management. And it's not going to help you except sort of get over a very short, awful bump in your life. But the problem is, the trauma from the bump will still be there. And if you don't deal with that trauma, not much is going to change. There's not going to be much healing. Now, I want to point out a book that I recently finished reading. I'm so high tech here. The book is even available on iTunes, and I bought it on my iPad. And the name of it is Unhinged by Dr. Daniel Carlat, C-A-R-L-A-T. And Dr. Carlat is a psychiatrist who's been practicing as a psychiatrist for a long time. And he was sort of at the forefront of the whole impetus to start medicating more people for things like depression, anxiety, all of that stuff. I urge you, if you are taking medication, to read his book. It's called Unhinged by Daniel Carlat, C-A-R-L-A-T. You can get it on iTunes, iBooks. You could buy it at most large bookstores. It's a very important book because it in very detailed fashion discusses the history of how all these medications came into existence and the push by the pharmaceutical industry to sell them, to get people to take them, to see them as this panacea, fix all, oh, we're going to make you happy, and oh, well, I wasn't really having that result with just my antidepressant alone, so now I take such and such a medication and I'm feeling a lot better. And I think you really need to read this book, because what Dr. Carlat basically says is that all of the purported studies to demonstrate the efficacy of these medications are questionable. They're mostly done by the pharmaceutical industry. They have no long-term tracking on this stuff, no long-term sense of, well, what are the long-term effects of being on this medication? My own philosophy on medication is, it's sort of like if you break your leg and you go to the doctor, they set the bone, they put your leg in a cast, they give you a bunch of crutches and tell you to be very careful while your bone is healing, but you're not supposed to spend the rest of your life walking with the crutches and the cast on your leg. It's a temporary fix until the bone has had a chance to repair itself and then be strong enough to support your weight on its own. Now, there are some medications that require chronic use. If you're bipolar, you probably will be taking at least lithium for the rest of your life, or whatever the newer medication that replaces lithium. And again, I urge you to read the book because it'll tell you a lot about that stuff. If you have psychosis or full schizophrenia, you're probably going to have to take antipsychotic medications for the rest of your life, etc. But if you're dealing with depression or anxiety, and you're only taking medication, as that's the only kind of treatment you're getting for those two issues, you're going to have problems, because depression and anxiety are caused by other issues in your life which you need to identify and deal with. It can be a poor relationship. It can be, and a relationship, by the way, could be with your family as well as with a spouse. It could be pressures of daily living. Maybe your children are all adolescents now and you're getting older and you're working at a job where your boss is like taking lessons in management from Simon Legree and cracking the whip and humiliating you on a regular basis. There could be any number of things bigger than simple, oh, I have a chemical imbalance and I need to take this pill every day. And kind of last but not least, there has been this whole chemical imbalance argument to sell the idea of medication. Oh, depression is a chemical imbalance and it needs a medical solution because it's a medical problem. Well, I was in like Psychology 101 in college before any of this medication was invented, and they talked about experiments with mice where they would put the mice into a box with an electric grid, and then they push the button routinely, randomly, so that without warning the mice would get shocked, they'd get electrocuted, okay, for momentarily. And what they discovered was that after a couple of months of that, the brain chemistry of the mice was altered, because they were expecting trauma, and when they got it, they reacted significantly to it, but then their brains were left in that state of trauma. And that's basically what's happening in this country, in our society. More and more people feel less and less in control of their destiny or their lives. Good paying jobs are evaporating. The public school system is stressed out. The public school system often wants to put kids on medication because basic childhood or adolescent male behavior is now considered too energetic or too aggressive for a lot of teachers in a lot of classrooms. There's just all kinds of pressure out there for us to normalize and, you know, take medication and this will calm you down and help you cope, and you have a chemical imbalance and that's why you need this. Please consider that the source of most of this information is the pharmaceutical industry, which is driven by the profits that it makes off of having you get that medication every month. And Dr. Carlat explains that in significant detail in his book. You should never, ever just stop taking medication cold turkey. You should always consult with a physician. If you have been receiving the medication from a psychiatrist, they are not going to suggest that you stop it for two reasons. The first is they have an investment in you. They see you every month. They want to make sure that your treatment is going well, and if you're not coming in for your medication management, then they're not going to be seeing you every month, and they will have concerns about that. More importantly, they have a liability issue. If they suggest that you diminish your dosage or go off of it altogether, and any kind of thing occurs, maybe you hurt yourself, maybe you hurt someone else, whatever, they will have liability. And so to avoid that, once you've started the medication, most doctors will never bring up the subject of your reducing or eliminating it on their own. It is a conversation that you have to initiate when you decide you want to have that information so that you can make an informed decision. Again, I urge you to read Dr. Carlat's book. I urge you to consider a number of things, talk with your therapist, but the bottom line is if you are taking any kind of medication that affects your mood for depression, anxiety, bipolar, any of those things, you should also be seeing a therapist once a week to talk about the issues, work through the stuff that's going on so that you can deal with the source of the anxiety, the source of the depression, the source of some of the manic behavior that goes along with bipolar disorder. You need the therapy, you need the conversation with a therapist. You can't resolve these issues just with medication. So I hope you'll consider that, and there are many resources available to you, and make sure that you exercise as many of them as possible before making a major life-altering decision. Thank you.